Hello and welcome to today's webinar. As part of the Medical Self-Care webinar series, we are in Phase 3. This will be the fourth and final webinar of our Medical Self-Care series. My name is Madison and let's get started. Before we begin, I just want to point out again, as I have in the past webinars, that we're doing this series because we care about you as an employee and a company, and your health truly matters. We're doing this because healthcare is a very precious resource and it's complicated, and we want you to have the information to get the most out of your healthcare. Like I said, we're in Phase 3, the last and final series. Phase 1 was all about collecting the information and contacting the right physician. Phase 2 was really getting into recognizing symptoms and reacting appropriately. And Phase 3 is going to be about preparing and performing, and I'll tell you more about that in a second. And once again, I just wanted to make sure we're all on the same page, and if someone is just joining us, they know what medical self-care is. Medical self-care can be defined in many different ways, but we are using the definition of medical self-care is what a person does to recognize, prevent, treat, and manage his or her health problems on their own. And some people say, oh, I've kind of, haven't thought about that before, you being a consumer of your health and being a medical consumer on that hand. But this is what it's all about, and we're going to dive right into it today. The objectives for today's webinar are outlined as followed. We're first going to outline what every employee needs to do to effectively prepare for every healthcare visit. And our second objective will be to provide you with instruction on how employees can more effectively interact with their doctors and other healthcare providers on their team. So let's get right into our first objective, preparing for your healthcare visit. It might seem strange to you that you need to prepare for your visit, but this is a very important part of medical self-care because you want to make sure that you are getting the very most out of your doctor's appointment. It's important because doctors have very limited time, and you only get to schedule appointments either for your annual exam or if you have other things you need to see your doctor for, but often they are few and far between if you just have regular visits. So it's important to do this, speaking to prevention, because people who prepare for their healthcare visits get better faster, research has shown, and according to the book on the right, they have lower healthcare costs as well because they're able to get more out of their appointment, and they're able to see where they can save money and maybe eliminate some unnecessary tests, which we'll talk about soon, and that's why they have lower costs. And they're also able to stay healthier longer because they are asking more questions, they're getting all the information that they need, and as a result, they're living longer, healthier lives. And this is, of course, according to the book that you see on your right, which is a great resource. What to bring with you. And also another important point of preparing for your healthcare visit, you need to bring the right things with you. And this is so important. The first one, an advocate. If you are maybe an older adult, or you're going to have some trouble either getting to your visit physically, or if you have trouble talking to doctors, you feel uncomfortable, whatever it is, if you can get more out of your healthcare visit with an advocate there, maybe someone from your family or a friend, that can make all the difference. Your personal health record, of course, from what we've learned in the previous webinars, is very important because your doctor may not have all of your records on hand, and even if he or she does, they may not be accurate. And so when you have your personal health record on hand, you are more likely to get accurate care, because what we've learned from the past webinars is that over 98% of your diagnosis is based on your personal health record. So having that with you is going to be very important, and it's very important in preparing for this doctor visit that you're going to have. A list of symptoms. This is important because sometimes you don't recall, what you had been feeling in the past. If when you had a chest pain, what it felt like, how long it lasted, as an example, whatever it may be. So it's important that you write down a list of symptoms and questions as well, which we'll talk about in the future. But writing down questions is so very, very important. So write down those as well, because you are most likely going to forget to ask them in the appointment, and you may run out of time as well. Bring all of your medications in a bag. This will help you not only keep them organized, it will ensure that they're all there, and you just need to bring every single one, including vitamins, supplements that you take as well, because believe it or not, some of those, what may seem like harmless vitamins and supplements, could maybe react with other medications or decrease the effect. And your doctor will know that if you bring all of your medications with you. And something to write on and write with is important, because just like it's important to have that list of questions ready, it's also important to write down the feedback you're getting from your doctor, because most of the people forget what their doctor said, the next day, a week, a month from the time you had your appointment. And they're probably giving you pretty important information that it's important for you to remember. So that is it. That is a list of very important things you need to bring with you, and it will help you prepare for your exam. I also want to point out, this is Dr. Monica Moore and some of her advice, a very well-respected doctor, and her view on crucial conversations. This is a list of some things that Dr. Moore has been through in her career, and things that she encourages her patients to ask, including, has anything changed since my last visit? Do I need to change any of my medications, vitamins, supplements? Do I need any new vaccines? People don't really think that they need vaccines anymore if they've had them as a kid, but the truth is that there are new vaccines that you may need, or your vaccines that you had when you were a child are no longer good anymore. And something like the tetanus shot you need to get every 10 years, and a lot of people don't have that up to date, so that's important to ask. How am I doing on my preventative screenings? Preventative screenings are huge, and if your doctor, and I've said this before, is not talking to you about preventative screenings, you need to get a new doctor, because an ounce of prevention is worth a pound of cure. If you can catch something before, it's a win-win for everybody, especially you as the patient. Do I need any new diagnostic tests? How would you rate my overall health from 1 to 10, and why? That's a great number to have from your doctor. How are you doing? And what changes would I need to make to improve? And this is so powerful, because a lot of doctors and patients talk about what's going on right now, and their current state of disease, whatever that may be, or maybe you're fine and they just talk about how you're doing okay. But there are always things that we could improve upon for everybody. And so it's important to ask this question as well. What can I do to improve? These are some other ones from Dr. Roderick Lenshaw about dealing with acute symptoms. So if you're experiencing some acute symptoms, these, according to Dr. Lenshaw, are some crucial conversations to have with your doctor that not everybody thinks of, and they're really important to cover, including where did this problem come from, and will your treatment address it? It's important to know the source of this problem and to make sure that the correct treatment is being applied. Does the treatment address the root cause of this problem? How much will it cost? What are my options? These are so important, because sometimes doctors, they don't explain all of your options, and there may be some other options that they didn't think of, or some lower cost options that work just as well. So it's important to explore those. When will I start feeling better? And if my symptoms get worse after hours, who do I contact? It's very important to know who to contact, because you don't want to have to dial 911 if you don't have to. It's important to get as much information about when you should start feeling better, and if you're not, who do you contact and when? And oh, the dreaded doorknob question. You're probably wondering what this is, or you maybe have experienced it yourself, but doctors call this the dreaded doorknob question. And what this is when you've had your appointment and you've covered everything, and then the doctor has his hand on the doorknob and he's just at the door, and then you say, oh, and one more thing, and you open up a whole new bag of worms. Doctors really don't like this, and it causes them to be late for their next appointment, and that pushes other people's schedules behind, and they really just dread the doorknob question. So this is why it's so important for us to be organized and prepared for our exam by having our list of questions and our list of symptoms and our advocate and our medications, and so we can get through our appointment efficiently and effectively so everyone can be seen by the doctor on schedule. And also a quick note on medical testing. This is really important because it's just very wise to inquire about medical testing. Asking if the doctor has a couple tests for you to do, to ask why they need to be done and if it really does need to be done, because sometimes doctors just want to run medical tests just to check things and maybe they're not really quite needed, and you could avoid a lot of charges that way. And who wants to do undergo unnecessary testing if you don't have to, especially if you're going to be undergoing some radiation exposure with an x-ray or whatever it is, MRI. It's just really important to inquire about that and making sure that you're only getting done what really needs to get done. Alright, so we have completed the first objective to outline what every employee needs to do to effectively prepare for their next healthcare visit. And now we will jump to our next objective as part of Phase 3, performing at your healthcare visit. This might seem kind of silly to think about how you're going to perform at your healthcare visit as if you were an actor or actress. It's not about that. It's just about being confident and setting yourself up for having the best appointment that you can. Because believe it or not, how you talk to your doctor and interact with them will affect the quality of care that you get. So here are some tips for interacting with your doctor. It's important to make eye contact. This shows that you are engaged in the conversation and that you're serious about getting the best care. Give and expect respect. Of course, it's important to be respectful, and you deserve respect as well from your doctor. Be honest. There may be some things that you're uncomfortable or embarrassed about, but being honest will definitely ensure that you get the best care, because if you're not honest about some of the symptoms that you are experiencing, then the diagnosis could be incorrect, and that's not going to help you get better faster. Believe that you will get better. Believe it or not, doctors appreciate optimism and trust in their care, and it's been shown that if you have a positive outlook, that people who are optimistic do get better faster, believe it or not. And it's so important to ask questions as well, because this not only gives you more information, it helps you develop your relationship with your doctor, and really helps you to become engaged in your health and your healthcare visit. Research says that patients, this is interesting, will often ask basic questions because, as I alluded to before, maybe they are embarrassed. They have a very personal question, or they're experiencing something that may seem very embarrassing to them. So patients will generally ask just basic questions, and they really struggle with asking those hard questions. So I think it's helpful to be aware of that. That a lot of people struggle with asking the hard questions, but ultimately those are really important questions that you need to ask to get the best care. So either have your advocate help you or write it down, whatever you need to do that would make you most comfortable in an uncomfortable situation. And this may seem very trivial, but have you ever asked your doctor to wash their hands if they haven't washed their hands? Or have you seen your doctor wash your hands in every appointment? Because you should. Your doctor or nurse or whoever your healthcare provider is at the time should wash their hands before your appointment. And it can be kind of strange if your doctor did not wash his or her hands before your appointment, because you want to know that they will wash their hands, but you don't want to ask them in an awkward way. So a way that I have found, and I've talked to other professionals about this as well, is to, instead of calling the doctor out and saying, hey, did you wash your hands? Because I want to make sure you wash your hands before my appointment. Instead, it might be helpful to say, I want to make sure that I'm washing my hands, for as long as I need to make sure that I get all the germs, and that's the most safe way. How often do you wash your hands, and what do you recommend for washing my hands? So something like that may help, because it's not directly calling them out, but it's bringing up the issue and reminding them if they forgot, or just bringing attention to the issue if they need to. Very important. What about asking for a second opinion? This is so important. If your doctor doesn't allow you to ask for a second opinion, or seems offended, that is a red flag. And Dr. Donica Moore, as I introduced before, her opinion on this is as followed. That is a deal breaker in any way for your physician. It's definitely a red flag. No doctor should be offended if you get a second opinion. In fact, if you are having a major surgery, or if you have a rare disease, there are several different treatment options, your physician should suggest that you get a second opinion. So not only is it perfectly acceptable, it's actually encouraged if you have, more of a rare disease or a complicated treatment plan. Definitely encouraged that you get a second opinion. Very important, and you should know that's definitely appropriate. One of the last things we're going to talk about is how to get men to the doctor. Research has shown that men are less likely to go to the doctor, and women are there's a higher percentage of women that go to the doctor, and women are more comfortable going to the doctor compared to males. So a couple tips. The physician might send a reminder to them. Scare them and bully them are kind of lighthearted, but at the same time, it's important that everyone, including men, know that if you don't go to the doctor, sometimes, you need to find these things out, and it can be scary because you might find out something scary, but it is also scary that something may be going on that you don't know about. So it's important to know those. Make an appointment for them is also that can help. Just if they're not making the appointment, go ahead and make it for them. But the way that has been shown to be most successful is if the significant other writes a personal note and says, "Hey, I know that we've been putting this off, and I know you might not want to go, but it's really important to me that you make this appointment and go to the doctor, because I care about you as my significant other, and I just want to make sure that you are okay, and we know everything that's going on." So those are a few tips on how to get men to the doctor. All right, and we have now outlined both of our objectives for Phase 3 of this webinar, to provide instruction on how employees can effectively interact with their healthcare team. And that finishes up our third phase of the Medical Self-Care webinar series. We have covered all 3 phases, and I hope that this has been very informational for you. And if you have any further questions, you can refer back to the other webinars, or please don't hesitate to give us a shout out through email at livewell@babbins.com. I hope you learned a little bit about medical self-care, and that moving forward you are more informed about how to contact the right doctor and react to situations and save money, and to have an effective, healthy healthcare visit. So my name is Madison again. Thank you so much for joining us, and have a happy, healthy day.